Hi, Jordan.
Hi.
Nice to meet you.
Nice to meet you.
How are you?
I'm good.
Okay. So I see here you are a first-time patient.
Yes.
Okay. Can you please verify your first and last name for me?
Yeah, Jordan Smith.
Okay. And your date of birth?
Yeah, October 4, 1998.
Okay, perfect. And when was your last head-to-toe assessment? Do you remember?
I think it was about 6 months ago.
Okay. Do you have any concerns today that you would like to address?
I've been having a little back pain. I have a history of my posture's kind of poor, scoliosis and such.
Okay. When were you diagnosed with scoliosis?
That was about 3 years ago.
Okay. And have you been wearing a splint or anything to adjust?
But now I'm just doing physical therapy.
Okay. And for how long have you been doing physical therapy for?
Since I got diagnosed, so about 2 years.
Okay. On a scale of 0 to 10, how would you rate your pain right now?
I'd say it's a 4, 3.
3 to 4. And do you have any history of anemia?
No.
Okay. Any arthritis?
No.
Okay. Any falls or fractures?
No.
Okay. Any hypertension?
No.
Okay. Have you ever had COVID?
No.
Okay. Sleep apnea or asthma?
Yeah, I have some asthma as well as sleep apnea.
Okay. Do you have any allergies?
Yeah, I am allergic to cats and dogs.
And are you allergic to any medications?
Not that I know of, no.
Okay. Primary language is English,
Yes.
correct? And who was your primary care physician before?
I believe it was, I think it was Dr. Clark.
Okay. Okay. All right, so let's go ahead and start your examination. I'm going to take your blood pressure, your heart rate, and your temperature. Okay, so this is going to go underneath the tongue. Okay, very good. 36.8 Celsius. And on your index finger, okay, I'm just going to go ahead and let this rest while we take your blood pressure. Is this arm okay?
Yeah, that's fine.
Okay. Okay, perfect. Okay, blood pressure is 110/68, which is normal. And oxygenation is 99 percentile on room air. Heart rate is 89, resting. well. Okay. Is it okay if I listen to your heart and your lungs? I'm going to put the stethoscope underneath your shirt.
Sure.
Okay. Okay, wonderful. Normal heart rhythm. I'm going to listen to your lungs now, so go ahead and take a deep breath in for me. And breathe out. Again, take a deep breath in. And exhale. Okay, good. I'll listen to the back as well. Very good. Okay, perfect. All right, I'm going to go ahead and start examining your head. I'm looking for any lumps or any asymmetry. Also, I'm noticing that your face looks very clean of any cuts, any bumps, and it looks very well perfused, no cyanosis around the mouth, so that's a good sign. I'm going to have you relax now and I will palpate your head. head is symmetric. I'm not feeling any lumps. And I'm going to go ahead and slowly palpate your neck and your jawline. Any pain here?
No.
That's good. Thyroid gland is non-enlarged. I'm not feeling any nodules. Can you please swallow for me? Okay, trachea is midline. it okay if I palpate your face as well?
Yes.
And I'm just going to go ahead and palpate right here underneath your eyes. And I just want to see if I feel anything swollen. Okay. Looks very good. Okay, any pain when I do this?
No.
Okay. Can you please clench your jaw for me? Very good. And now open a little bit and clench again. Very good. Go ahead and relax. Submandibular lymph nodes are not enlarged. I'm not feeling any lumps. Okay, I'm gonna go ahead and examine your arms now. I'm just going to lift this a little bit. Is it okay if I palpate your armpit?
That's fine, yes.
Very good. I'm not feeling any lumps. Okay, go ahead and relax your hand. Okay, skin is very well perfused. I'm not noticing anything abnormal, no spiroangiomas, no growths, no pain or tenderness upon palpation. I'm going to take a look at your fingers as well. Okay, good. Capillary refill is within 2 seconds. So good peripheral circulation. There's no redness in your palms. That's also a very good indication of health. Okay, skin is not dry. Okay, now I'm going to do the same thing on your left arm. Also examining your shoulder joint, feeling for any tenderness, any inflammation. Okay, and is it okay if I palpate your armpit too?
That's fine. Okay.
Okay, I'm not feeling anything swollen. This looks like a small bruise. Healing. Maybe you just bumped your shoulder into something.
I think I might have done that working out.
That makes sense. Okay. Capillary refill is within 2 seconds. Palms look very good. No pain, no tenderness. It's perfect. Okay, wonderful. All right, so I'm gonna have you lay down and I will examine your tummy now. Okay, Jordan, you feel comfortable right now?
Yeah, I feel good.
All right. So what I'm gonna do is I will lift up your gown a little bit just to have exposure to this part of your abdomen. Okay. And I will first listen with the stethoscope. Okay, very normal bowel sounds so far. Okay. And is it okay if I open up the pants a little bit just
That's
to
fine.
palpate on the lower side of the abdomen? Okay. So what I'm gonna do is I will percuss first and then I'll gently palpate.
All right.
Okay. Very good. Any pain as I'm palpating here?
No.
Okay. I will do a deep palpation now. Let me know if you're feeling any kind of pain. I'm not feeling any masses. Liver is normal size. No kidney pain either. And now I'll palpate your ovaries. Any pain as I'm pressing down? Okay. Both sides. I'm not feeling any lumps. Okay, that's perfect. All right, very good. I'm gonna have you now flip over and I will examine your back.
All right.
Okay, I'm gonna start by examining your cervical spine. I'm feeling your atlas and axis, C1 and C2. Also feeling your paraspinal muscles for any inflammation, any pulsating vibrations. Okay, there you go. there is a mild scoliosis angle, thoracic, in the thoracic area. I'm going to go ahead and tap. Make sure that we detect any fluid buildup. Okay, very normal sounds. And I'm going to palpate again. Let me know if you feel any kind of pain. And underneath the knee. Okay, I will slowly move your leg. Any pain?
No.
Okay. And push it all the way up. Any pain?
No.
Okay. And I'll just palpate your calf. No pain, no tenderness. Okay. Fetal pulse is 2 plus, strong. Good. Okay, and I'm going to go ahead and compare. Okay. Gap to your refill is within 2 seconds, which is normal. Okay, pulse is 2 plus, strong. Okay, now also palpate your gall here. Okay. And underneath your knee. Okay. And I'll just make some movement here. Let me know if you feel any kind of pain. Good. And I'll have you push up. Any pain in your spine as you're doing that?
No pain.
Okay. I'm not noticing any fungal infection. Skin is very well hydrated. No calluses. Okay, can you please pull your feet towards you? Good. Okay, very good. And now push with your pants. Perfect. And I'm going to lift both feet up and now push with your heels. Good. Okay. I'm going to go ahead and test your Babinski reflex. So what I'm going to do is I will strike the sole of your foot with a Sharpie point from the hammer. And I'm just looking for that neurological response. Good. 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 Okay. I'm just going to have you put your foot like this. Okay. Okay. Good. Go ahead and relax your foot. Relax your leg. Perfect. Okay. Relax. Okay, excellent. Okay, Jordan, so far everything looks very good. What I'm going to do now is I will check your hair follicle, make sure that it looks very good and healthy. So go ahead and relax your head. Yeah, that's perfect. Are you experiencing any itchiness, any dryness?
No.
And how often do you wash your hair?
2 to 3 times a week.
Okay. scalp looks very well hydrated. And I'm just looking for dry patches of skin, which would indicate poor perfusion. And it's very common to see those parts on the sides of your scalp. Okay. So I do see one. It is relatively small in size. Okay, so it's just mainly over here. I do have some oil that I'm going to go ahead and apply it right now.
Oh.
Okay, perfect. And are you wearing contacts right now?
Yes.
Perfect. So I'm going to have you look straight at my nose.
Mm-hmm.
I'm going to shine a bright light in your eyes to check pupil dilation. That's perfect. And I'm going to press down on your eyelids to check for, go ahead and look at me. Good. Perfect. And kind of the same thing. I'm checking your optic nerve now. I'll have you look straight forward at the wall, and I'll shine a bright light in your eye again. I'll come very close to your eye too, okay? So go ahead and try to keep your eyes as open as you can. That's good. Very good. I'll do the same thing on the other side. Perfect. So optic nerve is intact. I did not see any scratches behind the retina. All right, and let's go ahead and check your vision with the Snellen chart. So for this, I'm going to have you hold the chart with your right arm and go ahead and extend your arm all the way. Perfect. And I'll cover your left eye. And can you please tell me what color you see right here?
I see red.
And what about next to it?
Green.
Good. And can you read the last row starting with the first letter to the left?
Yeah. L, T, F, P, H.
Okay. And I'm going to have you switch hands now. And I'll cover your right eye. And can you read the last row starting with the first letter to the right?
H, P, F, T, L.
And what number do you see right here?
I see 4.
What about here?
6.
And which circle is Smaller, 4 or 5?
4.
Okay. All right. That was good. All right, I'm going to go ahead and check your mouth. Make sure that tonsils are not inflamed. So I'm going to have you give me a big ah. Go ahead and say ah. Okay, good. I'm not seeing anything swollen. Uvula is midline. Very good. Can you go ahead and stick your tongue out one more time and move it up and down and side to side? Good. And can you push with your tongue inside your cheek? And the other one now? Okay, perfect. Can you give me a big smile? And now frown. Good. Puff your cheeks for me, please. Keep them puffed. Don't let me unpuff them. Very good. And now I'm going to press on your face like this way. So I'm going to have you push the other way, okay? Okay. And same thing on the other side. Perfect. One more test. I'm going to press down on your shoulders and I'm going to have you shrug your shoulders. Perfect. And now can you please squeeze my fingers? Go ahead. Strong, 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 strong. Okay, good. Can you please close your eyes? All right. And now go ahead and lift your eyebrows up. Okay, good. And relax. I'm going to try to open your eyes. Don't let me do that. Okay, perfect. All right, let's go ahead and check your taste. I'm going to put one drop on your tongue and I'll have you identify what this tastes like, okay?
Sure. Tastes kind of cinnamony.
Okay, very good. All right, and let's see. We're going to go ahead and check your nose next. Just going to change the probes here. Okay, I'll take a look inside your nose. Perfect. Okay. Glands are not inflamed, not enlarged, and no redness. Okay, I'm going to have you close your eyes and I'll have you take a deep breath in through your nose. Okay, and can you please first describe the smell and then try to pinpoint what exactly it smells like?
Kind of citrusy, lemony, and there's a bit of, I guess, kind of an herbal smell. I'd say it kind of smells like a herbal tea.
Okay, that's very good. You can go ahead and open your eyes. All right, so what I'm going to do now is I will check how your body perceives the outside stimulus. So one is going to be a soft touch and the other one is going to be a cold, a sharp touch. All right, so I'm going to have you tell me if you feel sharp or dull, and I will explain. I'll show you first what dull feels like. So this is what dull will feel like, and this is what sharp will feel like.
Okay.
Okay, so go ahead and close your eyes and tell me if you feel sharp or dull.
Dull.
Good.
Dull. 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 Sharp. 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 Dull. 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 Sharp. 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 Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Sharp. dull, dull, sharp, 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 sharp.
Okay, perfect. Okay, I'm gonna go ahead and examine your hearing and your ears now. Have you noticed anything abnormal with your hearing?
No, I think I'm hearing well.
Okay. All right, I'm gonna have you look that way for me, and I'll take a look inside, make sure that tympanic membrane is okay, pearl gray, and there are no signs of infection. Perfect. Great. No signs of infection in both ears. Now I will check your hearing with the tuning forks. So what I'm going to do is I'll create a vibration sound and I'll put a tuning fork behind your ear. Can you please tell me when you don't hear this sound anymore?
Sure.
Can you hear it now?
Yep.
Okay. Same thing on the other side. Tell me when it stops. Stop. Can you still hear it now?
Yep.
Okay. And same thing, but just different frequency. Stops. Can you still hear it now?
Yes. Stops. Yep.
Perfect. And now I'll ask you to tell me which position here is louder, position number 1 or position number 2.
Right.
So this is position number 1. And this is number 2.
Number 2.
Okay. This is position number 2. And this is number 1.
Number 1.
Okay. Perfect. And now go ahead and keep your eyes closed. And can you please tell me with which ear you hear this sound?
All right. Left. Right. Both. Left. Left. Right.
Okay. And can you please tell me which position hears you hear closer to your ear?
Left. Left. Right.
Okay, very good. All right, and now I'm going to make some movements with your arms. Go ahead and tell me if you feel any kind of pain. You can open your eyes if however you feel comfortable. Okay, so I'm going to lift your arm up and back and to the side. Good. Perfect. Okay. All right. Okay, I'm gonna have you lift your left knee up. Okay, try to push it back down. Good, and now push it back up. Okay, and now your whole leg, go ahead and lift it up and put it back down. Same thing, lift it up, put it back down. All right, and now go ahead and lift up your knee. Good. Go ahead and push it down. Okay, good. Go ahead and relax. All right, and I'm going to go ahead and take some measurements.
Okay.
I'm going to take measurement of your head circumference first. Okay. Perfect. 27.7. Okay, let's go ahead and try that again. There you go. Okay. Okay. And I'll just take the circumference of both arms.
Mm-hmm.
And also your waist.
Mm-hmm.
Okay, perfect. All right, so I'm gonna have you sit back. All right, everything looks very good. I would recommend another head-to-toe assessment in about 6 to 8 months, just to keep an eye on your scoliosis and how it progresses. But I do want you to get an X-ray of your spine. Otherwise, cardiovascular system is good. Also, your skin is very healthy, so there's no concerns there. And do you have any questions for me?
Am I gonna get an email telling me? Okay.
Yeah. So I'll send you everything that we did through the email as well. And if you have any questions, go ahead and send us a message.
All right.
Thank you so much.
Mm-hmm.
And very nice to meet you too.
Of course, you too.